Hi friends, I am Dr. Gaurav Agrawal. I am a pediatric cardiologist working at Children Heart Care, Delhi. In previous video, we have discussed the types of AV canal defect as well as what are the symptoms of AV canal defect. In this video, we will discuss about the diagnosis and treatment options available for AV canal defect. For making the diagnosis of AV canal defect, the best modality of investigation is by doing pediatric echocardiogram from the chest of the baby. In that case, we have to do just like an ultrasound test. We put a probe on the chest and we can make almost every diagnosis of AV canal defect by doing pediatric echocardiography. Other supplementary tests that can be helpful in making the diagnosis are ECG and chest X-ray. And rarely we have to perform the cardiac catheterization. In that case only when the child presented after 9 months of age and we are not sure whether the patient is still operable or not. In that case, we have to do cardiac catheterization just to take the pressures in the various cardiac chambers of the heart, and we can assess whether the patient is operable or not. After making the diagnosis, what are the treatment options? The treatment of AV canal defect is only by open heart surgery. There is no role of transcatheter or angiographic method. Now, treatment will depend on various things. First is the size of the VSD, and second is whether there is stenosis in the pulmonary artery is present or not. First condition is when the VSD is very large, ASD is very large and there is no obstruction in the pulmonary artery. In that case, we have to treat this type of AV canal defect. Generally it is in the form of complete AV canal defect. We have to treat this type of AVSD by 3 months of age or especially before 6 months of age. Please don't delay after 6 months of age. The treatment is only by open heart surgery. Second situation can be when either the VSD is not there and the pulmonary stenosis is not there. Then in that case only the hole will be the large primum type of defect. In that case it will depend whether there is any leakage in the nearest valve or in the form of mitral regurgitation is there or not, and what is the severity. Suppose if there is no severe mitral regurgitation and only the ASD is there, then we can treat this type of defect known as the partial AV canal defect by 2 to 4 years of age only by open heart surgery. Third situation can be when there is severe stenosis in the pulmonary artery, whether the VSD is large or small. In that case, sometimes we have to do two-stage surgery. In first stage, we have to put a shunt known as the BT shunt between two great vessels of the heart from the back of the patient, or we can put a stent across this narrowing in the pulmonary artery known as the RVOT stent. This has to be done by angiography technique, but any of these method is palliative. This is not the final treatment. By doing these techniques, we can decrease the cyanosis or bluishness of the patient, and after few months we can do the final surgery in the form of open heart surgery, and we can take down either the RVOT stent or the BT shunt. My message from this video is whenever there is AV canal defect, please take this illness as a serious issue, and we should treat this issue as early as possible whenever your pediatric cardiologist is recommending. Please don't delay the treatment, especially in case of when there is no pulmonary stenosis. Please don't delay the treatment because patient can go into the Eisenmenger-like situation when we cannot treat this problem and patient has to live with this problem without correction. For more detail, you can log into my website childrenheartcare.com. Thank you very much.